What's up, YouTube? It's your boy, Mr. Elisha26, back at you again for the second time this week. I know that's like kind of unheard of, but I kind of felt like I need to make this video just because of a friend of mine named, we'll just go with TK or his initials. He's a cool dude. But we were having this conversation today, well, earlier this week, about him getting his dose changed because he was feeling like crashes and stuff like that because the dose was so small, so spread out. And I was just basically like, tell your doctor you want to change your dose. You know, you want to up it or you just want to change it to be more frequent, whatever. And so then today I found out he did call the doctor. Well, he called the doctor last week. The doctor got back to him and was like, yeah, go ahead and up the dose to blacka, and then do it every week. And he was just like, it worked. And he was like, thanks for letting me know. Thanks for giving me that advice. And then I just basically told him, like, doctors are in the service industry. They provide a service to us as patients. Yes, we go to see doctors to stay healthy, but they are serving us. We are not serving them. Like, their job is to do what is necessary to make us healthier, right? But if you're in our situations where you're like on HRT and whatnot, their job is to provide us with the T. So if you feel like you should be on a higher dose, or you want to be on bi-weekly or every week, or whatever, or you want shorter needles, because I use 1 inch needles to inject. I don't use 1.5 inch needles to inject. For one, my thighs aren't that huge. You've seen them in the videos. They're pretty small. For two, 1.5 inch needles are just a little bit more intimidating. I don't have a problem sticking myself, but with the 1.5 inch needle, I'm always afraid I'm going to hit the bone. I've had bone hitting extra, like, I've had, well, shot X's when I was in the military, and they hit the bone, and I hate that feeling. So that's kind of like an intimidating factor for me. So I've told them right off the bat, I don't want 1.5 inch injecting needles. I want 1 inch needles. And if they couldn't give that to me, then obviously that's not the doctor I need to see. And that's the thing. You have to remember that your transition is your transition. The physician, your endo, and your primary care provider that do the blood work or just are checking on you, whatever, their job is to provide you with guidance. But if you don't necessarily like the results that you're getting, like maybe your dose is so low that you're not seeing any changes, or maybe it's every week or every 2 weeks, or they want you to do your shots in your butt, you want to do them in your thigh, or you want to do intradermal shots in your abs, like, those are your choices. This is your body. Do your research to find out what the benefits and the cons are of the change you want to make, and then present that information to your doctor. And if your doctor gets up in your face about whatever you're presenting and makes you feel uncomfortable, or makes you feel dumb for asking, or like you don't know what's best for you, or you have no idea what you're talking about, that is the wrong doctor. You need to go find another doctor, because your doctor is supposed to be there to guide you, but they're not a dictator. This is not their transition. There is a lot of known facts about testosterone, how much is too much, and your blood work will show what's too much and what might be too little. But for the most part, you should have some say in the way your transition is progressing. When I went to the VA from a private clinic, they put me on 1 milligram, 1 milliliter, 1 milliliter of testosterone every 2 weeks. They knew I was on weekly shots prior. And the doctor told me, if you don't like the 2 week schedule, you can just go ahead and split it and do weekly, and then when we come back, we'll reassess. And so that's what I did. But every suggestion that I've had about needles, about getting blood work, about everything, my doctor has been perceptive. And if my doctor wasn't perceptive of my feelings as the individual transitioning, I would find another endocrinologist. Do not be afraid to tell your doctor what is or isn't working for you, what you like, what you don't like, or to just say, I know some other guys who are on this dose Why aren't I on that dose? You can question your doctor. They are not the end all be all of your transition. There's so much information on the internet, and yeah, that can be a good thing and a bad thing. But take that information to your doctor and ask them why this information says this, this, and this. Why isn't this good? Or why is it good? Why shouldn't I be doing this? Or why should I be doing this? Do not be afraid. The doctor is providing a service for you. If you do not go to that doctor, they don't get paid. So, true, you're not paying them per se out of pocket every time. Maybe some of you are. Your insurance might be paying, or but either way, they're getting paid. So they should be doing the service the way you want to do it, seeing how they are receiving compensation. Don't ever be afraid to tell your doctor something. And like I said before, if your doctor gives you like an aggressive response to you having questions about the way your transition is going, or why you aren't doing a certain thing, or why he has you on a certain dose, that is not the right doctor for you. They should have a very courteous, a very pleasant, respectable, comforting bedside manner. And that's just in a doctor visit. You should never feel intimidated by your doctor or your endocrinologist to do a certain dose or even a certain type of testosterone. If you want to do compounding testosterone, which can be cheaper and there are less shortages, your doctor shouldn't say, no, I won't prescribe a compounding testosterone from a compounding pharmacy. I only prescribe this, this, and this, the mainstream brand. Then you need to leave if that's not what you want. Do not let anyone back you into a corner with your transition. I just felt that this need to get out there because a lot of times we take what the doctors say to be fact and we don't question it. But always question what you're told. Never just take it as fact. If you hear this, and if you hear something else from someone else, or a better shot technique, or a better dose, or a better type of testosterone, or weekly doses versus bi-weekly, that's your transition. And if that's what makes you comfortable, that's what you want to try, then go ahead. I tried the bi-weekly and I didn't like it. So I went back to weekly doses. But if I want to go back to bi-weekly doses and I present that to my doctor, he should not try to deter me from that. He should provide the positive and the negative and then say we can try it and then we'll see you in 2 months or 3 months and we'll see where to go from there. But don't let your doctor take sole control of your transition. Be a excuse me, be a sounding voice in your own medical treatment. Okay? Don't be afraid to speak out, and if you feel uncomfortable, go someplace else. There's always another endocrinologist. There's always another primary care physician. There's always another clinic. Maybe you might have to travel more or whatnot, like with travel or trying to find them might be harder, but there's always someone else. And no one should make you uncomfortable when it comes to sitting in that office and discussing your treatment. I just wanted to get that out there because I feel like maybe people don't talk about that enough, about how doctors serve us and should not make you feel uncomfortable. We're a very marginalized group, so sometimes we take a little bit more abuse because that's what it is. It's an abuse of power if your doctor is doing that to you. Sometimes we take a little bit more abuse to get the results because of all the dysphoria and all that we have had to live with over the course of our lives. But I just want to say out there, put it out there that you shouldn't have to go through that. Just a little something that came to mind while having a conversation with another guy. He didn't necessarily go through that at all, but he did say that he always felt kind of like I can't ask questions or I can't present these ideas because they're the doctor, when that is not true at all. But yeah, so I hope everybody's having a great weekend. This is my third day at work off because I took Thursday and Friday off for my birthday. So yeah, I'll see you guys again on Monday. If you have any questions, comments, you can put them in the comment section. Or if you don't want to put everything out there, you want a little bit of privacy, you can hit me up in an email. It's definitely down there. Yeah, so feel free to hit me up if you need me. And I hope everybody's weekend is going well. Much love.